It's the Morning Brew with Friends on a Monday. Packed house today. We got Andrew Sussman from the UNM Comprehensive Cancer Center in. We got Greg Frost in, and we're going to talk about interest rates and some year-end numbers. John Nichols and Brooke are here with New Day Youth and Family Services. Brian Rurball from the Albuquerque Downs, and my buddies from the Posey Brothers Brewery. All in the Morning Brew. All right, it's the Morning Brew with Friends. We're kicking it off right away here with Andrew Sussman. Good to have you on.
Yeah, thank you.
I love it when you guys from the Comprehensive Cancer Center come on. Yeah. It's a mouthful to say at 7 in the morning.
It is a lot.
But you've got an interesting job title. I've never actually heard of a medical anthropologist. I know what anthropologists do, but I don't know what they do in the medical field.
Well, medical anthropologists study social issues around health. It could be around how people seek health care or the meaning people give to the illnesses and problems that they have. And the work that I do combines those things and tries to focus that to improve the delivery of health care and the access that people have to it.
Do you try to change their attitudes or just understand their attitudes?
A little bit of both.
Yeah?
And try to understand why they might be having barriers to the health care that they need, and also look at that across different cultural groups.
Ah, very cool. Yeah. And so you guys are now part of it's a $750,000 grant. It's got it's an interesting idea here. It's a geographic mapping of healthcare.
Right, so this new grant is funded by the National Cancer Institute, and that's part of the National Institutes of Health. And the National Cancer Institute has recognized that there are similar kinds of patterns of populations across regions, and that those populations may experience similar kinds of what we call health disparities or problems that people may have.
Well, like there's a higher incidence of, say, diabetes, I know, in New Mexico. Is that like one of the...
Exactly.
Okay.
There may be populations that have, for instance, along the border, there are higher rates of cervical cancer, and that may continue along New Mexico, Arizona, and even into California. So the idea of this geographic region is to bring those states together where we can work together and partner on these problems and perhaps come up with better solutions.
Cool. So there's 8 states in this, and we are now the hub for this, for the $750,000 grant.
We are, yeah. It's exciting. There are 8 states, including California, Arizona, New Mexico, Colorado, Texas, Kansas, Oklahoma, Nebraska, and we're the hub for all of these states. And that's newly started this summer.
So how did that start? Where did this grant come from?
Yeah, this is again from the National Cancer Institute.
But was it did they just decide, hey, we're seeing certain populations in these states, or did they just kind of say there's some money for research and you guys put it together?
Yeah, it's a little bit of both. They've always, they're one of the most major funders for cancer health research in the country, and they've recognized again that we can do a better job if we put these states together and partner. And so our job as this hub is to help facilitate these different researchers and help train new generations of cancer researchers, but bring them together to work on these problems in a collaborative way.
Cool. Well, this is one of the things that I'm imagining wouldn't have been able to have happened if the cancer center wasn't designated a comprehensive cancer center. Am I right?
Yeah, I think that certainly helps. It's nice to have that recognition, and the NCI sees that we have resources and a lot of different researchers doing work across different areas so that we become a viable hub for this type of activity.
Cool. Yeah. So what kinds of, where are you guys really studying, and what kinds of cancers are you finding there?
Well, we're doing work in a lot of different areas, and the exciting thing about this hub is that we can really work across all kinds of different cancers. It can even be work that happens in the laboratory or work that happens in communities. Maybe we'll try to connect together researchers who may be trying to promote colorectal cancer screening or other common cancers that affect people in this region. So it'll really be across the whole spectrum of cancers and even clinical work that's going on to try to help people.
Very cool. So how long does how long can you make $750,000 last?
Yeah.
I don't think it's a one-year grant, is it?
No, it's for 3 years.
Okay.
So we have a team here at the UNM Comprehensive Cancer Center of about 5 people, and we're going to be traveling and reaching out and working with folks all over the region. But this will last for 3 years, and hopefully if we do a good job, it'll continue beyond that.
Cool. So where are you most excited to go? And where are you guys seeing the biggest need for a lot of this?
There are a lot of different pockets of need. We'll be traveling around to all 8 states, so we're excited to go to some places we haven't been before.
You ever been to Kansas before?
I have not been to Kansas, so that may be a first, and some of our team will certainly go there. I may as well. So yeah, we'll be working in all those places.
Excellent. But is there one specific population or one specific region or one specific city, town, something you guys are really looking at for anthropological reasons maybe?
I don't think so. I think we're going to help identify where researchers and where we identify some of those greatest needs. There's nothing in particular we have in mind, but we do want to work with everybody, again, researchers throughout the different universities in this region, and see what projects and interests they have.
Very cool. Well, I love it when the Cancer Center folks are on, because there always is just great hope, it seems like, in the research that is going on.
Yeah.
I was telling you earlier, we had some folks on a couple weeks ago who were talking about personalized medicine and others that were doing some research that they think could actually just cure a certain kind of cancers. Where do you see as the most exciting research going on right now?
Yeah, I think it is an exciting time. There's certainly been new technological breakthroughs and developments in clinical medicine that have given hope to a lot of people. And
more data than we've ever had before.
More data and ways
genetic testing.
Yeah, it's an exciting time, and there's a lot on the horizon. And I think where this plugs in is to try to look at when we have these new developments, one of the challenges that's always been there is that sometimes people don't get access to these new treatments, or they have geographical or socioeconomic kinds of disparities. So we want to make sure that the most people can benefit from these new things as possible.
And with the grant, you guys, like, Cancer Center is great, but there's only one in the state.
Exactly.
So if you're in Las Cruces, for example, it's a 6-hour drive up here.
That's right.
How do you address that? Do you?
Yeah.
I'm assuming the $750,000 doesn't pay for shipping every cancer patient to Albuquerque. So what do you do?
No, that's a good point. We can't solve all these problems ourselves. And again, part of the value of this grant is that we can bring together researchers in partnership who may come up with better solutions. You know, different approaches could be telemedicine or other ways that we can try to reach rural populations. That's one of the main features of this region. There's a lot of people that are more isolated in rurally geographic areas. And so researchers are also interested in figuring out how we can best deliver care to them in ways that meet their needs as well.
Without having to ship everybody to Albuquerque.
That's right.
Yeah.
That's right.
Yeah, very cool. So, and how did you get started doing this yourself?
Yeah, I've been involved. I've been over at the university in the Health Science Center for about 12 or 13 years now, and I'm based in the Department of Family Medicine, but I have a role in the Cancer Center that's been very exciting and interesting, and so I'm interested, again, in this work in health disparities and trying to improve the health and healthcare delivery of people in New Mexico.
Love it. We're going to be back in a couple of seconds. Greg and I have been talking about this. He's sitting over here. Interest rates, Greg. This is the week that the Fed is actually going to vote. We're going to talk to Greg in just a couple of seconds on this on the Morning Brew with Friends.